welcome to our Homerton Voices. It's a podcast for our Homerton people by our Homerton people, and this is our first episode, so enjoy. My name is Michelle McVeigh, and I'm the Head of Engagement and Communication. And I have Matt and Margaret with me here. Do you two want to introduce yourselves as well?
Hi, I'm Matt Asbrey. I'm the Head of Culture.
Hi, I'm Margaret Bingham-Crisp, People Experience Lead.
Okay, and in today's episode, we are going to be talking about the 5 ways to Wellbeing, which is an event we're having that's kicking off next week on the 6th of September. Matt, do you want to tell us a little bit more about 5 ways to Wellbeing and why we're, focused on wellbeing?
Yeah, of course. So health and wellbeing is one of the core elements of our Homerton People plan, which is our plan to make everyone who works at Homerton a better working experience, and ultimately with the aim for Homerton to be the best place to work in the NHS. The last 18 months have been incredibly difficult. I really like the analogy of all being in the same storm but being in different boats. We've all experienced the pandemic in different ways, and we continue to be affected by it either directly or indirectly. But we know that from research before the pandemic and even through it, that people who are healthy and well, they look after themselves, actually deliver better care for our patients, and therefore health and wellbeing is ultimately a safety issue. And we know that health and social care workers are often the worst at looking after themselves. And when we're allowed on an aeroplane, and those who can remember what that was like, we're always told that, before we help others to put the face masks on, you put your own on first. And often health and care workers, we don't necessarily think about that. We always put others first and try and look after other people. But actually, this is about, if we're looking after ourselves, it places us in a better place to look after other people. So the 5 ways to wellbeing, the piece of the campaign that launches from the 6th of September, the 5 ways to wellbeing are an evidence-based approach to small incremental steps that we can all take to look after our well-being. And whilst it doesn't change, it won't take COVID away, it won't stop COVID from being there and affecting us, it does give us an opportunity and changes how we think, how we view those things, how we perceive and are in the best place possible to look after ourselves in everyday life. So the 5 steps are the 5 ways to wellbeing are being active, taking notice, connecting, keeping learning, and helping others. And we've got a week dedicated to each of those with lots of different activities planned through those as we go through, and lots of resources. I know, Michelle, that you and the team have been helping set up and get everything ready for that with, and in particular, Margaret. Margaret, making these changes in everyday life, how has the Trust got ways to support people with that?
We have lots of different ways that we can help support staff. It may be for yourself personally, or as a manager, you can signpost staff to these things. A lot of it is available on our intranet, and I'll give you a brief outline of what's available. We have Talk Changes, which is our IAP service. They offer a referral system. You can just go online, book yourself a referral, and they will contact you and talk you through some ways and means of coping mechanisms, etc. We have Health Assured, which is our employee assistance program. They offer a counselling service as well, but they also offer health and wellbeing apps. They also do webinars, and they also provide lots of information and service around general inquiries that, you may be having problems with your landlord, you may be having some issues about returning goods to shops, that kind of thing. So they're really good for providing that kind of support. And also, if you have a family member who is struggling, your family member can contact them and be able to get support as well, which is really, really helpful. as like Matt said, we've all been affected by this, not just us, but also our families. We also have First Steps, which is purely around childcare. They have done lots of webinars for us, but there is an email address where you can contact them if you're having any issues and concerns about your children who are obviously dealing with this situation and probably not being able to process it, as because they're young, they don't quite understand what's happening. And we also have occupational health, which is managed by OH Works. They have a dedicated telephone line. So if you've had any concerns around or self-isolating, getting COVID tests, or just general unsure about long COVID, etc., you can contact them and they'll be able to give you support as well. And then just bringing around to some sort of the other side of support we offer around salary sacrifice and benefits. We have Viva, which is our online portal. They manage our core scheme, which is managed by Tuskers. We have a cycle to work scheme, and then we have an electronic scheme that's open 3 times a year. They're all benefits that can give you a little bit of support financially and help you spread the costs of quite large purchases. We also offer a season ticket loan for those of you that need to purchase that to travel into work. We also have a lot of information on there about benefits that you can receive at shops, discounts, etc. I can only name a few because there's quite a few out there. There's the Blue Light Card, there's My Trust Benefits, Red Guava, health and self-service discounts. These are all services that you can register. The only one that I know has a cost to it is the Blue Light. You have to pay $4.99 for the card. But once you've got that card, you can use it in stores or online. These will offer you various discounts on anything from holidays to insurance to pet food to mobile phones. And I actually managed to bag myself 10% off at Wallace the other day, so that was quite a nice little bargain for myself. And I didn't quite manage to hide the purchase before my husband got in from work either, so I was in a bit of trouble. But that's me. But if you check out the internet, there are lots of things on there, and we're always open to hearing about new benefits that we can add. The local area, if you use your card, you go into any of the shops around and cafes on Chatsworth Road, etc., they often will offer you anything between 10 to 15% discount as well, which is always great. Now that we can sort of get out a little bit more and enjoy the facilities around us. And now I'll hand back to Michelle.
Thank you, Margaret. I use the staff discount on Look Fantastic for some Olaplex for my hair recently, so I benefited from it too. So as part of supporting health and wellbeing, as Matt talked about, we're focused on the 5 ways to wellbeing starting next week. So we've got an event. It starts on the 6th of September, and it'll go all the way through to the 8th of October. So it's 5 weeks, and each week is focused on one of those 5 ways to wellbeing. And we've got webinars, we've got events, we've got classes, we've got quizzes, challenges, and a bunch of resources as well to kind of help you in each area. All of that is going to be on the intranet. It's coming out in Homerton Light, so make sure you check that every Wednesday as well. And Margaret will be sending out some stuff through happening at Homerton as well, so keep your eye on your email inbox as well as the intranet. And all of the stuff we're doing, it's obviously there to support your health and wellbeing, but we want to focus on fun as well, so it's not going to be like a big chore. It's going to be things that you'll hopefully want to take part in, but also hopefully help start you towards building some habits to make those little changes long term that kind of will help you manage your well-being at the moment. And once we get past the pandemic and COVID, they'll hopefully keep benefiting you as you go on if you kind of practice these 5 ways to well-being. As I said, we're kicking off on the 6th of September with the Active Week. We'll be relaunching the Step Challenge. We've got a few free fitness classes, some stuff to help you with cycling to work if that's your thing, and just little things to kind of help improve your activity, because part of be active isn't about doing these like intense workouts at the gym. It's just about doing little things to make sure you keep moving, because it really does benefit your mental health, and it's something that I need to to do better, be more active. I don't have a car or a license, so I do walk a lot of places, which helps. I am looking at joining a netball team to help me be a bit more active and help me connect as well. What about you two? What do you do to stay active?
A bit like you, I don't have a car, so I like to walk a lot. But having had COVID early in the year, I've not done that as much because I found it quite difficult. So I step challenge, get my steps up, make sure I take a break at lunchtime and go for a little walk, even if it's just around the trust itself rather than off-site. I think that'll just be something I will be doing, and I'll try and maintain that throughout the challenge and afterwards as well, because I think it's important, because we'll be entering into the darker days and nights where we're probably not wanting to do as much, so it's good to start getting into those good habits now. So if anybody wants to join me in a walk, just drop me an email, and you'll be able to find me on the address, and I'll happily meet up with people and connect with you and have a walk around the grass.
Excellent. How about you, Matt?
So I commute in. So I've since I joined in February, I live up in the Midlands, so I commute down on the train. But I try and combine my commute with my exercise. So I get a walk to the station in the morning, and then I cycle into the hospital from there. So I managed to onto the different sites. So I managed to get a little bit of exercise. I do try and do running. I got quite into running a couple of years ago and did a few half marathons and a marathon. I'm nowhere near as fit as that now with a 1-year-old at home as well as my 3-year-old. But when I am back a little bit more able, I'm going to be keen to do that. But I really agree with you. I think it's really important, Michelle, that as you said, it's not necessarily about thinking you have to go out and go and run a marathon. It can be as simple as going out. I got really into my running through park run, and I think if anyone has experienced and done park run, it will know it's a fantastic thing, and I really missed that through the COVID lockdowns. But anybody who hasn't done that, park run is a really fun and free way just to interact, and even if you walk it, you will never finish last. But it's also about not necessarily having to even go into that sense. It's about small and little changes. So thinking about how to break up your day, moving away from your desk, moving away from your ward area, or out in the community, and changing our habits. So I know that Margaret and I manage Margaret, and we've been on walking meetings before, where actually getting outside, getting a bit of fresh air and talking about things that we've got going on and supporting with that. It is small little changes that actually really help and benefit us, and don't have to be massively earth moving in order to build it into our everyday.
Yeah, definitely. I mean, I always take the stairs, but I used to work up in the Blue Roof offices, and anyone that's gone up there, you'll know how, no matter how fit you are, those stairs are always so exhausting. But I very rarely take the lift unless I've got something heavy to carry. So it's just little things like that. Just if you can, just increase your activity by like just tiny bits wherever you can.
You know, you can get off the bus a stop earlier and walk into work or
walk
home. There's simple things that you can do like that. And I'm like you, I don't actually like the lift, so I always use the stairs. And my tip to get up to the Blue Roof is I do one end of the corridor, then walk and go up the second bit. So I don't actually do them all in one go, which it is. I don't quite hyperventilate when I get to the top now, but but that sort of helps a little bit with trying to stagger, trying to climb them up all at the same time, Michelle.
So that's a good tip. I'll remember that. Yes, so please do join us for 5 Ways to Wellbeing, starting 6th of September. We'll be kicking off with a launch webinar with Tracy Fletcher and Matt, who's on the podcast with us now. And if you missed that live, it'll be up on the internet as well, along with everything else. We'll be going through some of the active week, and then we're going to take notice, connect week, keep learning, and then finally ending with help others week. So hopefully we'll see you around at some of these events.
Thank you so much for listening. We're going to put the links to everything that we've mentioned in this podcast below. So there'll be links to the internet, to the webinars, the fitness classes, anything else that's going on, including all the stuff that Margaret mentioned as well, the staff benefits and wellbeing
information, so you can access that at any time. And hopefully we will see you at the webinars, some of the classes, events. Please do get involved. These events is for everybody here. So please do take part and have fun. We'll see you there. Thanks.